So we're first going to talk about the nutrition work and specifically some work that we've been doing around food service guidelines. So the first one is around the Mary Mitchell Family and Youth Center. And so this organization completed cooking modules from Lenox Hill Teaching Kitchen and introduced new recipes to the students in the Food Justice Club. The youth were surveyed to decide which recipes to incorporate into the center's menu. The club has also been learning about competitive foods and have created their own booklet that they plan to distribute to neighboring schools. They also surveyed the community about cost and availability of healthy food and have used their findings to inform their food justice initiatives in the community. Emma?
Good morning, everybody. In regards to our Healthy Pantry initiative, is focused on training food pantries on the nuts and bolts of implementing food service guidelines, including the procurement of healthier food and creating a healthier environment. This year, Bronx Health REACH trained 4 new partners. Post-training, these sites adopted a nutrition policy and started implementing client choice model to allow clients to select their own food, much like they would a grocery store. Manna of Life Ministries, our partner here, expanded their garden created in 2021 to help supplement the fruits and vegetables offered at the food pantry. It also provides the community with a space to learn about healthy eating.
I think it's back to you, Kelly.
Okay, so this one is on the food demo training program. So Bronx Health REACH partnered with BCA Global and Chef Tanya Lopez to organize a program for food pantry leaders on leading food demonstrations with clients and introducing recipes with foods that are offered at the pantry but may be unfamiliar to them. 8 participants completed the program and are using the skills learned to bring more sustainable food demonstration programming to their food pantries. 2 of the food demo training participants, Henrietta Osagi and Joel Weber, helped to lead food demos at a Mindful Eating for the Beloved Community event at Raymore and Flanagan in the Bronx with BCA Global, and the event was featured in the Bronx Times Reporter. Next. So Bronx Health REACH partners Jarrell Owens, known as Gio, and Bishop Timothy Burkett from Church Alive Community Church collaborated on the production of 3 television episodes about food service guidelines in food pantries. These aired on BronxNet and were also shared with Church Alive's network of Bronx churches. Next. And Bronx Health REACH worked with Lehman College to establish a student-led food justice campaign. 9 students plus the food justice coordinator collaborated to assess the food service environment on the Lehman College campus, surveyed students about their opinion of campus food, and promoted and participated in a CUNY-wide virtual conference about imagining healthier campus food environments.
Our health books and farmers market promotion. Health books are $2 coupons used to purchase fruits and vegetables at NYC farmers markets. 16 partners from Bronx Health REACH faith-based outreach initiative distributed more than 3,600 health books and collectively completed 27 farmers markets walking tours with 392 participants.
Moving on to Morrisania WIC Farmship Program. For the past year, Morrisania WIC, with support from Bronx Health REACH and Corbin Hill Food Project, has hosted a farmship program to provide more fresh and local produce to WIC participants, staff, and nearby residents. Since the program's inception, 179 individuals have participated and purchased 698 shares. We are currently conducting an analysis of the program to help us better understand who participates in order to seek funding in the future.
So Bronx Health REACH collaborated with the Bronx Impact Food Access Collective to provide input into the White House Conference on Hunger, Nutrition, and Health and hosted a listening session with the Bronx Health REACH Nutrition Fitness Work Group. The input was shared with the White House. And we also co-hosted a faith dialogue informing the conference as part of the Good Food Dialogues process and a holistic climate solution summit organized during Climate Week New York City. A summary of the dialogue was shared with Good Food Dialogues, and key points were sent as guidance to also inform the White House conference.
Hi,
Rachel?
good morning.
Mhm.
Hi, good morning, everyone. I'm going to talk a little bit about the breastfeeding initiative now, starting with our partner, Albert Einstein College of Medicine. They created and circulated the Breastfeeding for Our Future media campaign to normalize breastfeeding in the Bronx. The posters were installed in bus shelters, Link NYC kiosks, and posted on social media from April through May of 2022. Einstein also this year established a new baby cafe / breastfeeding support group, the Einstein Healthy Start Breastfeeding Support Group, and hosted 16 BHR sponsored baby cafes with a total of 74 participants. In honor of National Breastfeeding Month in August, Einstein hosted Titillating Tuesdays, weekly Zoom sessions with such topics as the power of breastfeeding, breastfeeding journeys, breastfeeding know your rights, breastfeeding circle of support. A panel of lactation professionals, birth workers, and family members hosted these sessions. The sessions in total, the 4 sessions had about 170 participants. Each session was led by a different lactation professional. Einstein and Morrisania Wick organized a virtual subway caravan to discuss the updated American Academy of Pediatrics breastfeeding recommendations. More than 80 participants attended at points throughout the session. Morrisania Wick also hosted Indigenous Milk as Medicine Week and Black Breastfeeding Week in August for National Breastfeeding Month. One of the events during Black Breastfeeding Week was an African Mothers Breastfeeding fashion show. Attendees wore traditional clothing with their children in traditional baby wearing garb. Cultural traditions that prioritize and support families were highlighted throughout the show, as you can see in the pics. And finally, Morrisania Wick Baby Cafe conducted 29 BHR sponsored baby cafe sessions with 176 moms in attendance. 5 of the sessions were working edition baby cafes for working moms, so they took place at night to accommodate working mothers. And lastly, we conducted a breastfeeding training at one partner site, Agatha House Foundation, which is part of our faith-based outreach initiative. All right, moving on to physical activity access, we're going to start with Bronx River Alliance. Bronx River Alliance hosted a spring equinox event on March 20th in Starlight Park, welcoming over 60 people to River House and the Greenway. A free community paddle on Friday, June 17th, with over 30 paddlers, and a monarch celebration in Concrete Plan Park on September 3rd for over 40 people. I'm gonna let Kelly take it away to talk about transportation alternatives and youth ministries for peace and justice.
Thanks, Rachel. So to gain support for a complete street transformation of Boston Road, Transportation Alternatives narrowed down the priority corridor to Bronx Park East and Allerton Avenue as a focal point. They organized a walkthrough and street scan for new political leadership to support these efforts. Transportation Alternatives spoke to the Transportation Committee Chair of Community Board 11 about these changes. The Grand Concourse Phase 4 changes are on track, with efforts to address some areas of concern raised by community residents. Transportation Alternatives has identified possible improvements, including modifying the variety of flower beds to a consistent width and standard set, pushing for cameras to enforce speed limits, and adding a dedicated bus lane. They have worked to gain support from Councilmember Alethea Stevens. And St. Helena Church, with the support from Transportation Alternatives and Bronx Health REACH, mobilized community support for complete streets changes at the intersection of White Plains Road and Westchester Avenue in order to improve safety for pedestrians. With support of TA, 227 petition signatures were collected, and they were able to engage Councilmember Amanda Farias in conversation about the issue. And the next step is meeting with Department of Transportation. Our partner, Bronx Bible Church of Christ, is working on complete streets improvements at the intersection of Morris Avenue and 170th Street. Improvements include a protected bike lane on Morris Avenue, building sidewalk extensions, improving signaling at the intersection for turning cars, better signage placement, and speed bumps. A petition has been created and signatures are being collected. And Youth Ministries for Peace and Justice worked with the New York City Department of Transportation, New York City Department of Design and Construction, New York City Department of Environmental Protection, local elected officials, and other community stakeholders to reconstruct Morrison Plaza and adjacent Herod Place. The renovation increases and improves the quality of public space available to commuters, shoppers, and merchants. YMPJ advocated for key amenities such as water fountain, granite seating, bike racks, and lighting. And I'm going to pass it to Diana to talk about some work with schools.
Thank you, Kelly. Hi, good morning, everyone. So I want to start off discussing about the open streets that we did with PS18. So in June, PS18 was gifted with 65 bikes and helmets by USA Cycling and Major Taylor Development. And PS18, along with Bronx Health REACH, Equity Design, Street Lab, and Major Taylor hosted an open street program on 3 Saturdays in October. So the streets that were closed was 148th Street from Morris Avenue to College Avenue. So it was closed to cars and open to pedestrians in order to provide students and the surrounding community with a safe environment to ride their bikes and play. They also held bike clinics where kids would learn about bike safety and how to ride a bike. And on the first Saturday, we had 15 students registered. And by the third Saturday, we had 90 kids registered. So it was great to see how word of mouth really helped this program grow. The next slide. We also held an open streets event at PS32 with Bronx Health REACH, Equity Design, and Street Lab. And we hosted 2 Tuesday open street programs in October on Belmont Avenue between Grove Street and East 183rd Street. So after school, students were invited to utilize the closed street to enjoy arts and crafts, fitness activities, and an obstacle course. Teachers, parents, and students were also invited to walk around the school block to get in their steps. And about 4 laps around the school is equal to a mile. And ultimately, the school would like to have a track painted around the school for the community to utilize. Next slide, please. Thank you. Other work we've been doing with the schools in the Bronx is we've held school wellness mind mapping sessions. So Bronx Health REACH and Equity Design have conducted extensive outreach in order to conduct mind mapping sessions where schools, teachers participate in physical activities, followed by a brainstorming session to write down what health and wellness should look like in their community. And so far, 18 schools have participated in these sessions. Along with other work we've done in schools is we also have a Bronx PE cohort, which started in spring of 2022 by Equity Design. And these sessions bring together PE teachers from different Bronx schools to share their challenges and successes to see each other as an additional resource. So yeah, and I will pass it on to Michael.
Good morning, everybody. I hope everyone's having a great start to their December. I'm Mike Johnson. I'm the communications associate, but also team leader for our test and trace initiative and COVID-19. Next slide, please, Immaculata. So the New York City Health and Hospital Test and Trace Initiative, Bronx Health REACH was given and part of the New York City outreach team from way back in August 2020. So we've definitely been there, I guess, from the start in terms of outreach. So this year, actually, the test and trace contract concluded. And after all was said and done, the Bronx Health REACH team assisted in getting over 7,800 COVID-19 vaccinations administered through community vaccine events in the Bronx. The team distributed signage, masks, educational resources about COVID-19 testing sites, COVID-19 vaccination information, COVID-19 test kits. This was distributed to schools, daycares, mosques, churches, senior centers, businesses, and national organizations based in NYC. And of course, all this would not have been possible without the team itself, consisting of Sheikhu Omaran, Joseph Ellis, Felix Rojas, Barbara Toledano, and Mariah Bernzales. And I'm passing it over to Mariah now.
Hi, yes. Okay. Can you see me? I can't see myself. Okay, so my name is Mariah Bernzales. I'm the program manager of the CDC COVID and Flu Vaccination Initiative. As part of this initiative that's been going on for the past more than 2 years, we have vaccinated just in the past year 1,303 people against COVID, just under the umbrella of the CDC grant, 258 people against the flu, and we have distributed 35,451 COVID educational packets to Bronx residents at outreach and vaccination events, and 13,112 educational packets on flu illness prevention and vaccinations. We, of course, have done a lot of educational presentations as well, and trained 5 community partners, organizations, and 30 people to be trusted messengers. We launched our flu campaign, Flu Fighters campaign, this September at Mexican Coalition, where we had 98 people vaccinated, and it was broadcasted on the Bronx News 12. In November, I attended the COVID-19 Health Equity Summit at the White House about our COVID-19 successes over the past 2 years. I also wanted to share some data. We did 50 surveys with men and 10 with women about their attitudes about and concerns about COVID-19 vaccines. The men were ages 18 to 73 across 7 zip codes in the Bronx. And overall, those surveyed indicated low confidence in the COVID-19 vaccines. Surprisingly, some of those individuals also got the vaccine. We would like to recognize the 7 members of the Community Advisory Board for their insight and support in developing the program needs assessment plan and evaluation process. Sheikhu Ann of IFH, David Kulabali, Veronica Eccles, who is a school nurse at Office of School Health, Cruz Fuchsman, and Anthony Otten of New York City Psychotherapy and Counseling Center, Reverend Joseph Jones of Mount Hermon Baptist Church, Morey Kuwait of the African Immigrants Commission of New York City and Connecticut, Abigail Ring of Bronx Works, Vera Galeas of Sacred Heart Church, and Junior Udano Khan of Word Life Ministries. Thanks also to our 4 community health partners, Fanas Barbershop, Islamic Cultural Center, Mexican Coalition, and the Spanish University Seventh-day Adventist Church. If you could go to the, and then also I just wanted to note that through, we are also part of a coalition called NYSEAL under an NIH COVID-19 initiative. Bronx Health REACH, NYU, and Mount Sinai work together to develop community health workers training in motivational interviewing under that initiative. We also participated, had our community health workers participate in several NYSEAL trainings, news literacy, engaging youth and family in COVID-19 conversations, exploring misinformation landscape, understand bias and conspiratorial thinking. I think next is Eve.
Yep. Hi, everybody. This is Eve Plotka. I'm going to talk for a second about the Health Disparity Work Group and the Not 62 campaign for a Healthy Bronx. So first, during the September Health Disparity Work Group meeting, Christine Muganda from the University of Wisconsin that helped prepare the Robert Wood Johnson County Health Rankings Report came to present on the Bronx health data. In October, members of Bronx Health REACH scheduled congressional visits with staffers of Bronx elected leaders, Congressman Richie Torres, Congressman Jamal Bowman, and Senator Schumer. At these visits, Bronx Health REACH advocated for the Not 62 campaign and furthering the relationship between the community and their offices. Another significant focus for the health disparity work group this year was on the growing mental health crisis in our Bronx community. As a result, the work group decided to include a point on mental health in the advocacy asks that we've created. And I will pass it back over to Ema.
Racism in a Family's Health, Connecting the Dots. It's Bronx Health REACH third annual symposium. The symposium was designed to better understand how racism manifests in organizations, help identify the needed tools and strategies to address race and racism, leading the organizational-wide culture of respect, equity, and inclusivity. The speakers included for the symposium Doris Dalton, Church Director of Leadership Development and Intercultural Competency at New York Conference of the United Methodist Church. Ms. Dalton discussed why talking about race matters and the faith connection to this issue. Other presenters were representatives from the Center for Racial Justice in Education, a nonprofit organization that trains and empowers educators to dismantle patterns of racism and injustice in schools and communities. The Latino Health Outreach Initiative is a faith-based hypertension initiative focused on the Latino community in the Bronx. Corazón Saludable, Vida Saludable, or Healthy Heart, Healthy Life, uses community education to improve the health and prevent hypertension for at-risk or high-risk community members. This is a train-the-trainer model used to have participants recruit leaders to be trained as peer educators and recruit 10 to 12 participants to implement the program. We currently had 6 partners complete the training and implement the program from November 2021 to January 2022. 9 partners completed this program with 136 participants. The participants reported changing their eating habits to help control their blood pressure, reducing salt, sodium consumption, and using herbs and spices and eating more whole grains and vegetables. And then I'll go ahead and pass it on to Kelly.
So Life Together Works New York City has been co-facilitating a community resilience model to strengthen social cohesion and identify long-term recovery needs from COVID-19 for Community District 9. They have a team of 15 community leaders who are building community capacity and identifying community assets, and have 5 community stewards conducting weekly wellness call checks with seniors and other vulnerable community members. They kicked off the program in August with a town hall that had over 100 people in attendance. Ema.
Our Immigrant Health Initiative goal is to improve the access to healthcare, addressing cultural and language barriers, and targeting resources and intervention. This initiative also assists immigrants victims of trauma, exploitation, and addresses cultural language barriers. Then I go ahead and pass it on to Joseph and Michael.
Sorry, multitasking here, someone in the chat here. So I just wanted to point out, first of all, Mr. Ellis, Joseph, he's one of the team members, and actually, I don't know if you saw when Mariah gave her narrative, she was in her vehicle, and actually the team is, they're setting up for an event that's gonna happen today at a mosque in the Bronx. So I'm actually going to speak on Joseph's part, because Joseph, when you're looking at this photo, the Minority Male Wellness Initiative, this basically, Bronx Health REACH this year, we launched a Minority Male Wellness Initiative. This funding is from the New York State Department of Health, and it's a twofold focus. It's to increase COVID-19 vaccination rates in Black and Latino men. And the second thing is it's to provide a forum called Men Let's Talk for Black and Latino men to be able to engage in open and honest discussions about concerns or points of interest on their mental or sexual well-being. On October 8, 16 men gathered at the Institute for Family Health Stevenson Health Center for the launch of the Men Let's Talk series. Dr. Eric Gale, he's the Chief Medical Officer for the Institute for Family Health, and Philip Acer, he's a physician assistant at the Mount Hope Family Practice. Mr. Brett Scudder from Scudder Intervention Services Foundation, and Rex Jones from the New York City Department of Health and Mental Hygiene, who, side note, sadly passed away a week after this meeting, spoke to the group on COVID-19 mental and sexual health. Just a quick backstory here and why I pointed out Mr. Joseph Ellis. Joseph, back in 2020, actually started sort of what became, the first, because Joseph always said, we should have something that's addressing, men, because men are unfortunately notorious for, I could put things off, I could go see my doctor later, it's not important, and unfortunately, find out too late that you do have to put your health in first. And he actually, in January of 2020, there was an event held, and we all know what happened in 2020, of course, with COVID. So he kept at it, and we were able to get this grant, and so this came to fruition. And then in November, we had a second Men Let's Talk session. It focused on anxiety, depression, and stress using prepared stories to start off the discussions. We have our next one scheduled in December for the 17th. And myself, Mr. Ellis, Sheku Ann Omar, and Felix Rojas, we are coordinating this initiative. Next slide, please. So for media coverage this year, as Mariah had mentioned, News 12, the Bronx, they covered the launch of the Bronx Flu Fighters campaign in September. And an organization that we've worked with, it's called FYI, they're a New York City-based nonprofit. They worked with us as part of our campaign to increase the rate of COVID-19 vaccinations. We spoke about this last year for those of you at the meeting. You probably remember I got vaccinated for my mom. Well, we found out that we were honored at the Shorty Impact Awards. We received a silver honoree for Best Local Campaign. This award honors the most creative and effective social good campaign targeting a single geographic location using social media, digital platforms, and tools. I got vaccinated for my mom. The advertising campaign featured 4 pairs of Bronx-based mothers and sons. It appeared as in this photo, you see it's on Link NYC, but it was also on Bus Tales. And I remember this for when it started, and for a lot of months afterward. Every time I saw a bus, I was constantly turning, looking at the back of the bus, and I did see these campaigns going.
Thank you, Michael. So one, I want to thank our partners throughout the presentation by the different members of the team. You heard reference to the partners that have been intrinsic to the work that we're doing. So a huge thank you to the partners. This is all made possible because of your partnership. Also want to take the opportunity to thank the Bronx Health REACH team, who are the folks helping to move this initiative along, really committing their all to the work that we're doing and to the partnerships that we have formed. So in addition to the partners, a huge thank you to the Bronx Health REACH team. And then we also want to thank the funders. On the next slide, you will see we have listed the funders that have made all of this possible, starting with the CDC. I mentioned earlier that this year marks Bronx Health REACH's 23rd year. In 1999, we got our first REACH grant, and we have been extremely fortunate to continue to be funded by CDC during the different iterations of their REACH funding, in large part because of the amazing work that this community coalition has been doing. We have built up a body of work that has really made it possible for us to continue funding, to be funded by CDC. In addition, the New York State Department of Health funds several of our initiatives, creating healthy schools and community wellness. I was talking to somebody from the state couple of days ago, and we both realized that they have been funding us, starting with our Healthy Start program for maybe at least 15 years. So that has been a long time funding. In addition, we've had recent funding from them for the building resiliency and inclusive community. They fund the Latino Health Outreach Initiative and the Minority Male Wellness Initiative that you heard Michael just report on. We also have funding from New York City Health and Hospital Corporation for our T2 work, and the New York City Council has long funded our immigration work. And finally, you heard Mariah talk about the work that we're doing under New York SEAL, which is the New York City Community Engagement Alliance, to end COVID-19 disparities, and that funding is an NIH funding. So huge thanks to our funders as well. Their funding makes this possible.